1 in 1 lakh men suffer from testicular cancer. Once he goes to the second stage, then all the signs and symptoms of any other cancer in the body will come. Testicular cancer is more common in young men, except one thing, cryptorchism, that is undescended testis. And advise the men to undergo the self-examination.
Thank you so much for joining us, Dr. Sharath. Again and
I'm
again.
really honored to be with you.
Yes. Whenever we have needed you and whenever we have asked for your time, you have been gracious.
No, it will be my pleasure. I take it as an unique honor to be with you.
Today, beyond fertility, I want to talk about male testicular cancer. So first thing first, I want to ask you the most common symptoms of testicular cancer.
Sure. Before going to that, I'll just introduce the subject.
Sure.
So testicular cancer is not so common in men compared to prostate cancer or other. But the one thing about the testicular cancer is it is easily diagnosed and easily treated. Easy to diagnose and easy to treat. 1 in 1 lakh men suffer from testicular cancer. And cancer is more common in young men, 18 to 35. Testicular cancer is more common in young men, 18 to 35. And easy to pick up. By self-examination of the testis, a person can himself come out with a diagnosis saying that I have got something, a lump or a nodule in the testis, in one of the testes or both the testes. And that's enough. And one simple ultrasound examination will clinch the diagnosis. So only two tests are required. One self-examination and second an ultrasound examination. If self-examination is not possible, the doctor will examine and find out whether there is a nodule or a tumor or a growth in the testis. So the most important thing about the testicular cancer is easy to pick up and easy to treat also. And the outcome is very good in case of testicular cancer. The treatment outcome is excellent. That is, after the treatment, the possibility of the person living for more than several years is much more. So it is better to pick up the testicular cancer as early as possible and advise the men to undergo the self-examination whenever possible, yearly once or 2 yearly once, and pick up if there is anything wrong. And before going to the next thing, I would just like to tell why the testicular cancer occurs. That is the etiology part. Why men suffer from testicular. Unlike other cancers, like say lung cancer, we know smoking is the cause.
Yes.
For other things, so gastrointestinal tract, we know spicy food may cause these ulcers, and ulcers may become cancers. And the bladder cancer, we know that exposure to toxic chemicals, those who work in the industries, toxic chemical industries, they have the chances of getting the cancer of the bladder more than the others. So certain etiological factors are known for other cancers. But for testis, till date, no specific cause has been found out, except one thing, cryptorchism, that is undescended testis. If the testis is remaining in the abdomen, the testis which is remaining in the abdomen may undergo malignant changes. So that is the only one which is known, very well known. And if any person has not got the testis both in the scrotum, both the testis have not come down to the scrotum, then we have to immediately examine him, find out where the testis is lying in the inguinal region or in the abdomen, and then remove it as early as possible, because the testis is which is remaining in the abdomen, intra-abdominal or inguinal, can undergo transformation and become malignant. Or alternatively, it can be brought down to the scrotum and fixed. That is called as orchidoplexy. So either we have to do orchidectomy, removal of the testis itself, or do the fixation, that is orchidoplexy. So this is the only known etiological factor. And one more factor is genetic factors. Several families have been found to have more frequent testicular cancer than the general population. So the possibility of genetic factor cannot be ruled out. So these are the three things, that is etiological factors we should know. Yeah, over to Jamie. Yeah, now it's over to you.
Well,
I wanted to introduce the subject more. This
is much better. You mentioned only 1 lakh patients suffer from testicular.
Yeah, 1 in 1 lakh. Yeah, it is quite rare.
1 in 1
compared to lung cancer or compared to lung cancer, oral cancer, the other prostate cancer, bowel cancer. This is less known. That means we must feel happy that it is not so common.
Yes. But I'm a little surprised at the age factor because I was hoping.
Yeah, the younger men suffer more. 18 to 35 is the age where the cancer occurs. And of course, cancer occurs in the old age also. They are not picked up. That means if you see a cancer of the testis at 40, he might have had it earlier. It was small, he has not picked up. Now it has become huge and he has come. That means this one. The why it is more common in young men is because this seminiferous tubules and the germ cells, they are very actually involved in the production of the germ cells, and something may go wrong and they may start producing more cells and become malignant. That is why it is more common in reproductive age group of men, that is 18 to 35, active reproductive age group.
Mhm.
Yeah.
You talked about self-examination.
Yeah.
Could you elaborate on that? How do they?
Yeah. It's very easy. While taking shower or while going taking bath, the person will be 100% private. He is locked inside the bathroom. And once he removes his underwear, he can just palpate both the testes and see whether both the testes are present in the scrotum. And secondly, if they are present, both are equal. And third thing is just press gently, find out whether there is any pain or any hard mass or a nodule in one of the testes or both the testes. Testes, they should be soft, and when you press, we should feel as if you have pressed a banana. The consistency should be of that one. If you feel that there is something inside, a nodule, hard nodule, rock-like, or something irregular, or something unusual, which was not there earlier, then one should go to the doctor, urologist, or a sexologist, or a concerned doctor. Then the doctor will make an examination. And if he also feels, yes, there is something going wrong, then immediately he will send him to the ultrasound examination. One ultrasound examination is enough to find out the tumor. And
So
of course, later on, blood test, tumor markers, CT, MRI, they will all come to the picture later on to find out whether there are secondaries where it is spreading and other things. Primary diagnosis of tumor is done with the ultrasound itself.
For self-examination, they have to check the testes to see if they're both of the same size and length, and also consistency when they have to press it, and when they press it, the consistency
gently. They are not press it hard. Gently press it. If they press hard, they will call you and telephone you. Jamie, who is that doctor who asked me to press? I pressed and now I got pain and and he may sue you on me. Gently palpate it and
Okay.
Yeah.
So they have to gently press it, and it should be like the consistency of a banana.
Yeah.
Okay.
Yeah.
All right.
Yeah.
Then what are the most common symptoms?
That is a very good question. The most important symptom is that the person starts feeling that one testis is dragging and slightly painful and some discomfort whenever he puts the underwear. Especially if he puts the tight underwear, he feels that something is wrong in that testis. That is one thing. That is if the tumor is in the initial stage.
Okay.
If the tumor goes on to the second stage, then all the symptoms of cancer of any other region starts appearing. Weakness, debility, nausea, vomiting, feverishness, and pain, tenderness, and loss of weight, loss of mood, loss of libido, loss of erection, and he may even land up in infertility, is unable to produce the children. So in the first phase, there will be only dragging sensation in the testis. No systemic problems will be seen. Once he goes to the second stage, then all the signs and symptoms of any other cancer in the body will come. And if he reaches the third stage, metastasis occurs, distant organs are involved. If metastasis goes and sits in the brain, you will get all the signs and symptoms of a brain tumor. If it goes and sits in the lungs, all the signs and symptoms of lung cancer appear, cough and blood in the sputum. And if it sits in the bone, severe pain. If it sits in the joints, severe joint pain. And if it goes to the lymph nodes get enlarged, and if it starts feeling the lumps in the neck, under the arms, under the groins. So, and even they may be start visible to others. They may say, hey, what's going on here? I feel something. So distant metastasis results in other signs and symptoms, and he may land up in hypothyroidism also, hyperthyroidism also, and beta HCG level increases, and that may result in various hormonal changes. And the testosterone comes down, and it may result in gynecomastia, enlargement of the breasts. So the signs and symptoms depend upon the which stage the tumor is, whether it is in the first stage, second stage, third. First stage is only a nodule in this one, only a doctor can pick up and ultrasound can pick up. Second stage, patient himself comes with so many multiple problems. Third stage, diagnosis is written on his forehead. Yeah, he has got the cancer, stage 3. So these are the signs and symptoms.
You mentioned that the prognosis of early detection is very good for testicular cancer.
Yeah.
Could you share more?
Yeah. I before that, I will tell you that treatment aspect. Treatment is one thing is, if it has been picked up in the stage 1, it is very, very easy. Just remove the testis, orchidectomy, and put an incision in the inguinal region, pull the cord, that is spermatic cord, take out the entire thing, including the testis, epididymis, tunica, and the coverings, and the spermatic cord, and the veins around it. So, do radical orchidectomy. That is, complete testis will be removed. But it is not just it. Yeah.
Won't that affect your, chances of getting your partner pregnant?
Yeah, I will come to that. I'll get in the prognosis. I'll come to that. In the prognosis, I'll come to that. Okay. So, if it is stage 1, it is orchidectomy. In stage 1, is still potent because the other testis is working. Is still potent, and if you do the sperm count, it will be normal or subnormal. It is not enough for the lady to become pregnant. But at this stage, we should immediately ask him to save his sperms in the sperm bank so that it can be used later on. Suppose it spreads to the opposite testis, and if chemotherapy and if radiation therapy has to be given, the opposite testis also gets damaged inadvertently. So once we diagnose the testis, the first thing we have to tell him is go and store your semen for future use, because most of the men who have come here are in the reproductive age group. And secondly, though they may say, no, I don't require now, you still convince him. What the most important thing is, before doing chemotherapy, radiation therapy, orchidectomy, we have to ask him to store the semen in the sperm bank. And orchidectomy, if it is stage 1, it is enough. If it is stage 2, then radical surgery, including removal of the lymph nodes in the inguinal region, and in the lower abdomen, and in the pelvis, and in the retroperitoneum, they have also to be removed, because in stage 2, it has gone to the lymph nodes. And the possibility of the tumor going to the other testis is also there, and the scanning of the other testis should be done. If we suspect that the malignant cells have traveled to the neighboring testis also, that may also have to be removed. So that is radical pelvic surgery has to be done. And if it is stage 3, if distant malignant deposits have already occurred, then it is very difficult to treat. We have to treat only symptomatically by radiation therapy, by chemotherapy, whichever the organ is involved. That organ has to be done subjected to radiation therapy. And since the spread is hemotic, that is through the blood, chemotherapy has to be given. So the treatment depends upon the stage under which it has been picked up. And regarding the reproduction is concerned, most of the times, by the time we pick up, luckily, they would have already become father, because we would have picked up at the age of 30, 31, 32. They would have married and they would have had the children. Suppose